สวัสดีครับ I'm Dr. Samai Sirithongthaworn, Deputy Director of Department of Mental Health Thailand. Today, I would like to share our experience in mental health area during the COVID-19 pandemic in Thailand. The outline of sharing today, the first is situation, challenge, resources, and the main presentation is the response of our team, mental health team in Thailand. The first one is how we strengthen the nation's resilience, and the second one is how can we improve our service, new normal psychiatric service. In this presentation, or in Thailand, we use the picture of Upwell, Australia, to describe the impact of COVID-19 pandemic in Thailand that divided into 4 waves. The first wave meaning is the immediately mortality and morbidity by the COVID-19. The second wave is the impact of resources restriction on urgent non-COVID condition. And the third wave is the impact of interrupted care on chronic condition. And what that we talk about today much is the fourth wave. The fourth wave is the impact from the psychological impact, which may be result in psychic trauma, mental illness. Economic injury may induce mental disorder and burnout among the health personnel. The first one, the situation. We have assessed by rapid survey at different time, at different period of time. We compare between health personnel and general population. We found that the health personnel have higher severity of stress than normal population. And we predict that from our experience last 20 years ago, when the economic crisis at that time, the suicidal rate less from 6 per 100,000 to 8 more 100 per 100,000. So we predict that this time may have the same situation like 20 years ago if we don't have any intervention. So we plan that to control the rate of suicidal rate not more than 8.8. After intervention, it will be lessened, but maybe not be at the normal rate as we have before the COVID pandemic. The effect of COVID-19 to the health situation in Thailand, the most impact are quarantine person or infected person, which may be result in some stigma. The second group is medical personnel may have burned out after take care of the patient. And the third group is the general population may get economic injury and vulnerable groups to mental health problems. All of these 4 groups may result in the stress, drug and alcohol problem, depression, suicide, or even create a social disorganization, increased crime and divorce, or domestic violence. How we respond for this condition? We try to manage to strengthen the nation resilience. The main group are personal resilience. The second group is family. The third is the community. Anyway, they also have the same mechanism. That is to increase mental health capacity and to decrease the negative mental health effect. So, primary objective is that to reduce the consequence of mental health from stress, burnout, suicide, and depression. And as I mentioned, to strengthen the resilience in individual, family, community, or organization. How we deal with the personal resilience? The first one is to promotion. Promotion is to promote health literacy and behavior adaptation in coherence with new normal style. And prevention is to active screening, active surveillance, and give some psychological first aid to destigma them in the society. And treatment, if they need by psychosocial intervention or as according to clinical guideline of that disease. Rehabilitation is to empower the public capacity and build up resilience and destigma in the community. And family resilience. Family resilience, we try to help the family to have positive attitude to solve any problem, crisis, to adapt and share their role and responsibility in the family, and to help them to have a unity to overcome the obstacle during the COVID pandemic. The third, the community. We try to build up the four model style of building up hope, safety, calm, and destigmatization. That means to let them have a connectedness in the community. How we do? To build up the safe community, to build up the calm community, to build up the hope community, to build up the stigma or connectedness in the community. I will share later. And try to use the community capacity. The first one is to use the community efficacy, such as the social support in the community, to empower strong leadership, communication, and encouragement in the community, and let the community concern and common sharing and common problem solving plan. The last one is to use the community capacity, to use community set common goal, set common trust, and help each other by social support and information sharing. We also prepare some media for them too. The first one is as in the left side, the blue one is the psychological first aid. We call it 3L. It means look, listen, and link. Look is looking forward to any, look forward to or look after to anyone that need help. Listen to them and refer if they need to get some more specialist treatment. And on the right side is some example of the media of resilient activity, such as we call it 3D. 3D is the first one is durable, determined, and to defeat with mindfulness and awareness to the problem. And some media such as healthcare. Healthcare is social distancing, wear face masks and always hand washing. And on the right you can see how they can take care of their mind to cope with the COVID, such as to understand their own mind, to always receive the collected media, and to keep themselves healthy and get consult if they need, and to be careful not to forward or bully other people. And this is some example of our mental health check-up by mobile phone or mobile application to test for stress, anxiety, depression, and even other disorders such as dementia, EQ, or resilience quotient. Not just personal, family, and community, we also give new normal psychiatric service. That means we improve our service to the patient too. I will show later in detail. To summary, the intervention that we give to the community or to the nation is that to strengthen the nation resilience among personal, family, and community, and to strengthen new normal psychiatric service among psychiatric hospitals in Thailand or even the general hospital. This is the result for screening of list 4 group. The result of the resilient pandemic COVID in Thailand, and the result of new normal health behavior assessment, and the fourth is the result of a community strengthened resilience. The fourth group that I mentioned is that the health personnel, the patient itself, quarantine group and risk group. All of these groups we have higher than 80% of screening of all groups. And among the resilient area in Thailand, we found that more than 80% of people in Thailand have normal or higher standard of resilient power. The third one is the new normal behavior such as wearing masks, social distancing, and washing hands. We have a rapid survey in June, July, and August. More than 85% of people still keep on their behavior. And the fourth is we have developed the resilient community to be as a pilot model so that they can expand or can transfer their knowledge to other community all over Thailand. This is the mechanism that we do. The main important mechanism is a health village volunteer, and they will work in the community. We call it a community mental health vaccine. How can we do? Normally, health village volunteer will work as a primary health care to promote health and to screen for the disease. So we give training to the health village volunteer more than 40,000 people in mental health area. This is a picture that we give training. After training, they will go to home visit, or we call knock door visit, to share their knowledge and to look after the other villagers and to give some necessary food, hand washing gel, and healthy information. This is the process. Workflow. The first one is to training the health villager volunteer in their psychological first aid, and to give training for mental health screening. The second work is to go home visit or even the telephone visit. The third is mental health screening for stress, depression, and suicide. The fourth is to give, look, listen, link, psychological first aid, and refer if they need more specialist intervention. We also provide smart health villager volunteer application in the mobile phone to provide health information to communicate about the health emergency and screen for mental health problem. About the community, as we term it as a community immunity, is that how we can make the community safe, calm, whole, and connected. I will show in detail right now. The first one, the health village volunteer will set up a checkpoint like this, to check for fever, to check for health behavior such as wearing mask, and to give alcohol gel to them, and clean the public area, and visit the other villager, so that they can provide knowledge and something as a food or some other to support economy. The second one is to promote calm, is that the community leaders will go around to visit the villager and to give their knowledge and to support their emotion by broadcasting, and even by broadcasting tower, and provide a creditable information to the people in the community about the COVID-19, and try not to let them have a rumor about the COVID-19 communication fact. And to promote the sense of hopeful by visit the people in the community when they got ill, and to support and promote sufficient economy, such as to find some work, some job for them, to find some food for them too, and create a system that can help the people who suffer from economic impact. The last one, when they are recover, the patient who are recovered will get communication with fact about COVID, and when they recover, we will have a less compassion and understand to not let them to be stigma in the community. No strong society without strong mental health. And right now I will show about how we improve our psychiatric service as a new normal. Anyway, the show must go on. Thailand have to working on and to improve and adjust our intervention according to the situation of the disease. Thank you very much.